So this exercise provides a safe environment. Being a scenario based, it provides a safe environment for us to be able to assess whether the plans and mitigation strategies that we have in place are going to be effective.
And obviously, you know, this week we have seen how disastrous an outbreak can be in a retirement village. I know there's more than 11 now deaths. I think it's a Sydney-based one. So I guess, are you guys using that as an example of how serious you need to focus on disaster management?
We are certainly quite focused on what's happening in Sydney regions and overseas, and we've taken some ideas from what's happened in those areas to plan our scenario, and also in terms of the strategies and processes we have in place to mitigate the risk.
And what are the scenarios? Can you give us some examples of what you guys are doing?
What we'll do is basically set the scene of the aged care facility, and then there'll be a number of special ideas that get introduced of people that become unwell, and the aged care facility will then have the opportunity to respond to that, and I'm sure they'll involve our public health unit to also give them some guidance and support in managing containment.
So it would be, you know, this patient's become a positive case, how do we remove them, or how do we, you know, look after the other people? Is that kind of what you're talking?
Yeah, and also how it might get introduced into a facility. So it might be about somebody who comes to visit the facility or somebody who works at the facility. So we'll look at how it gets introduced, and as many mitigation strategies as we have in place, that lowers the risk considerably, but we can't eliminate the risk of the virus getting into a facility, because there's some people with limited symptoms who are still able to transmit the virus.
It's very hard to find people, I guess, who are infectious, isn't it?
It is.
Denise, how does that look like? I know Sam sort of trying to touch on it there. Someone gets the virus and say the forest centre, you know, what happens to the rest of the guests there, the rest of the residents, I should say? Do we go into lockdown and set up, you know, a nursing station within the centre itself? What does it look like?
Evan might be able to give a bit more guidance around that, but it's a mixture of, we do screening as people are coming into a facility to make sure that everyone that's coming in is well. If somebody in the facility does become unwell, they get isolated so that we can contain it to just that person. They get treated by staff that are all wearing personal protective equipment to prevent them transmitting the virus to anybody else. So there's a range of measures that we put in place to contain it to just that person that becomes unwell.
Okay.